Hello everyone, my name is Hernandez. Thank you for being here this evening. I'm here to discuss the 3 different levels of the neonatal intensive care unit, also known as the NICU. The NICU is the first step of parenting a preemie baby. It can be very overwhelming, and knowing a little bit about the NICU will help you get through it if you have a child that's in the neonatal intensive care unit. Imagine if you were 6 months pregnant and your water broke, and your doctor told you that your baby was high risk. That is when you need the NICU. The NICU is also called a special care nursery. It's made especially for babies that are born early or that have complications during the delivery, or sometimes they might get sick at the hospital, and that's when, the NICU takes care of your child. The first time visiting the NICU is very overwhelming. I know this because I had a child that was born premature, and she weighed 3 pounds and 7 ounces. And the first time that I went into the NICU, it was very overwhelming and scary because I didn't know what was going on. But as I went in there, and the nurses were very kind to me, and they explained to me the different things that were going to happen to my daughter, it made me feel more comfortable and less terrified, and then I was just at ease with everything that was going to happen with my daughter. So, on that note, let's first talk about the first level of the NICU. The first level is 1A, and that is just basic nursery for the babies that are born healthy, full term. There's nothing wrong with them. Level 2B, or 1B, is care for infants who are 34 weeks or greater, and they weigh 1,800 grams, or almost 4 pounds. And 4 pounds is considered healthy, not real healthy, but it's good enough for the baby to go home or to not have to stay in the NICU. Although sometimes babies that are born at 34 weeks sometimes have mild illnesses. Sometimes it'll be jaundice, or they might have a slight infection of some sort and they need antibiotics. But the infants at 34 weeks also sometimes have problems breathing or have problems with their respiratory system, so they have to receive oxygen for short term. Level 2A are for infants that are born at 32 weeks, and they weigh 1,500 grams, or 3 pounds and 3 ounces. And these babies have mild illnesses, but they aren't long-term illnesses, and they're expected to recover quickly. And these babies will need IV infusions and perinatal nutrition. And perinatal nutrition is when they feed the baby through the IV. And these fluids that go through the IV have vitamins, fluids, and amino acids. Or amino acids, fluids that contain vitamins. Level 2B is the same as level 2A, but the infant will have total perinatal nutrition, which means they'll constantly have to be fed through an IV infusion because they can't eat on their own just yet because they're still too early to eat, so they have to feed them through IVs. And they also, for babies that are born at 32 weeks, have to have an umbilical central line. The reason why they use that is so that they can prevent from having to constantly stick the baby in different areas like the foot or the head, the arm. So if they have an open central line, they can just go through that central line every time to feed them, to give them blood transfusions, or any kind of IV fluid that they may need. Now the level 3 of the NICU is the most critical, and that one's for the severe preemies that have been born really early. This one has 3 different sections, A, B, and C. And level 3A are for infants that are 28 weeks and weigh 2 pounds and 2 ounces. And they have to be provided with life support because they cannot breathe on their own at all. And the preemie babies that are born at 28 weeks sometimes need minor surgeries. And these surgeries are surgeries that they have to maybe put a catheter inside the jugular vein, the groin, or the chest. And they sometimes have to repair certain hernias that the baby might be born with, or that just come up while they're in the NICU. Level 3B is for infants that are 28 weeks or less, and they weigh less than 2 pounds. And they receive advanced respiratory support because they cannot breathe at all on their own. And sometimes they have a sleep apnea, and that means when they stop breathing for less than 20 seconds, and that's when they have to put them on a monitor that wraps around their abdominal area, and if if they stop breathing for more than 20 seconds, the machine goes off. And that's when you have to perform different tasks to wake them up, like you have to pat them on the back or maybe kind of slap their foot to make them wake up. I had to do this with my daughter. Also, sometimes they have to have major surgeries. And these are like the cardiopulmonary bypass surgery or the repair of the abdominal wall. And level 3C is also like level 3B, but it has more support. Like they have more doctors that are on hand constantly. They have extra care. They're constantly receiving certain kinds of respiratory help because they can't breathe on their own either. Their lungs sometimes are damaged or not mature enough, as well as the heart. The heart sometimes is not mature, it's just damaged and it needs the extra help. So they have cardiac and respiratory support. It also provides on-site subspecialty consultants, like pediatrics or the anesthesiologists. And they also get urgent CTs, MRIs, and echocardiographies, and specialized testings as needed. So level 3 is the most critical and severe because these preemie babies are very high risk and a lot of things can happen to them. So they always have to have on-site doctors and physicians to be there with them. Now, parenting a newborn is intimidating on its own, but if you have a preemie baby, it's a lot more overwhelming because the baby isn't healthy, has a lot of complications, and there's a lot of things that the baby needs, a lot of special care that it needs. And preemie babies are in need of constant specialized care, and the NICU provides that. They're there constantly 24/7. The higher level that your baby has to be in, let's say if it's in level 3, the baby will be assigned 2 nurses 24/7, always by their side to make sure everything is okay. And my intention for this speech was to inform everyone of the NICU and to just reassure that even though sometimes unexpected things can happen during pregnancy, whether your baby might be unhealthy or might be just a slight problem, the NICU will always be there to care for your child and to make sure that everything is fine. And our hospitals are also equipped and specialized in the NICU. And the NICU is always there to make sure and to minimize risks and help these little ones get the best start in life. Thank you.